他前天休克，感染性休克了，我们怀疑他肺里面产了出不来，然后现在他的3个比较活。
Bismillahirrahmanirrahim. What's up, guys? My name is Yaul. I'm from GME first 4 semester from International Medical University. So in today's presentation, we will talk about the COVID-19, the current situation in Pakistan. We will also talk about the people fallen and sick with COVID and the people recovered and died. We will also talk about the problems with medication and the treatment. And what is the role of FDA and WHO in all this pandemic. So let's start it from the very beginning. On 31st December 2019, WHO was informed of cases of pneumonia of unknown cause in Wuhan City, China. And now coronavirus was identified as the cause by Chinese authorities on 7 January 2020 and was temporarily named as 2019 nCoV virus. So virus that cause COVID-19 is in the family of viruses which is called coronavirus. nCoV 2019, N stands for novel, so it's a completely new strain that has not been previously identified in humans. So it transfers from animals to humans. It exists in those places where animals are in abundance, like slaughtering house and animals market. There are two versions of this virus. Virus that cause SARS. SARS stands for Severe Acute Respiratory Syndrome. We call it SARS-CoV virus. While the virus that causes COVID-19, we call it SARS-CoV-2. If you talk about the mode of action of this virus, so coronavirus cause infection in the respiratory tract, such as nose, mouth, throat, sinuses, and lungs. There are many types of coronaviruses, but most of them causes mouth illness. We call it common cold. But some coronaviruses can cause severe illness. Mostly people can be infected by droplets secundenta viruses. These droplets carry the air into the air and can enter through the nose, mouth, throat, and lungs of a person who are in 6 feet or 2 meters. The virus infects the lungs, causing the lungs to become inflamed. We know that alveolar sacs are responsible for the breathing in oxygen and breathing out of the carbon dioxide. So infection of the virus causes damaged cell of the lungs and triggered inflammatory reactions. So fever may develop. With severe inflammation, inflammatory fluids fills the lungs. So this reduces the function of alveoli, and the resulting of which coughing and difficulty in breathing will be occur. More and more the oxygen level in the lungs will be decreases, and in some cases other organs may also be infected, like this occur in severe cases such as kidney and heart. Rule of FDA. FDA stands for Food and Drug Administration, which exists in UK. So they prescribed the first drug which called Remdesivir. Remdesivir is the first drug which is approved by the FDA for the treatment of hospitalized COVID patients over the age of 12. The research shows that some patients recover faster after taking this medication. Your doctor may also give you medication to thin your blood and prevent clot, such as angiotensin converting enzymes inhibitors, and angiotensin receptor blocker, and statins for other health problems. The FDA has also issued an emergency use of authorization for the two drugs. We called it monoclonal antibodies to treat the COVID-19. So the first one is the Kyrgyzstan and the Epidemiological. These two can be given to the high-risk patients who have recently been diagnosed with mild to moderate illness to lower the level of the virus in the body and lower the risk of the hospitalization. The FDA is also allowing clinical trials and hospital use of blood plasma from people who are recovered from COVID-19. In order to help the patient with severe or life-threatening case, you will hear this called the convalescent plasma. So clinical trials are underway for other medication including tocilizumab. This is also another medication which has been used to treat the autoimmune condition and an inflammatory condition called cytokine or cytokine release syndrome. Next we have hydroxychloroquine and chloroquine. These two drugs treat malaria and autoimmune conditions like rheumatoid arthritis and lupus. Lupus is a disease in which long-term autoimmune disease in which the body immune system become hyperactive and attacks normal and healthy tissues. Why we can't find solution up to now? Because of the drugs we used having some side effects and the different stages or categories of the patient we have. Like some of the patients which have age less than 20 while others have greater than 50. So the patients which have greater than 50 also have some other diseases like diabetes and heart diseases. So we can't achieve our aim to find a single solution to treat COVID-19. Tests used in the laboratories. There are two kinds of tests used in the laboratories. First one is the antigen test, frequently referred to as rapid test. So the test detects the protein fragments specific to the coronavirus. It can be done in a clinic, doctor office or hospital. Turnaround time for the test is usually very quick, and in some cases the result can be reported within 15 minutes. Next we have PCR test. PCR stands for polymerase chain reaction. So PCR is considered as the gold standard in SARS-CoV virus 2 detection. The test actually detects the RNA, we call it genetic material, that is specific to the virus and can detect the virus within days of infection. So even those who have no symptoms, turnaround time is longer, generally 2 to 3 days range, but result can be as in a little as 24 hours. Next we have rapid test. Rapid tests are most accurate in patients who have COVID-19 symptoms, while the rapid test can get your results very quickly. So the result may not always be accurate, only in those who have symptoms of COVID-19. If you talk about the people fallen and sick due to COVID in Pakistan and all over the globe, so it is a report of 21st April 2021. New cases were detected 5,857 in Pakistan, while on 23rd April 2021 there were 0 cases detected in the whole day. So previously on average 7 days we have 4,850 new cases. If we count the total cases in Pakistan, there are 7,84,000 and recovery rate are 6,82,000. If we see here the graph, while the death rates are 16,842. While on all over the globe, we have a total cases of 146 million, while the recovery rates are 83.8 million and deaths rate are 3.09 million. Like other countries, Pakistan also working day and night to get rid of this pandemic. But like other European countries, we didn't have enough resources to treat and to get rid of this pandemic. So stay safe, hope for the best. Thank you.